I would now request Dr. Rajesh Shah to please introduce our next speaker.
Our next speaker is Dr. K.M. Prasanna Kumar. He is from Bengaluru, and his topic is reversal of diabetes. He is a MD/DM. He is a consultant endocrinologist in Bengaluru, and his area of interest is in diabetes and thyroid. He is awarded with prestigious awards, and he was a past president of RSSDI. Now I request Dr. K.M. Prasanna Kumar to start his talk. Thank you.
Good morning, everybody. Today we are going to discuss the reversal of type 2 diabetes. Is it a myth or a reality? At the outset, I would like to thank the organizers of this meeting for giving me an opportunity to discuss some of my view and experiences about reversal of type 2 diabetes. I don't have any conflict of interest for this. Let us start with a case vignette where we have seen a 20-year-old young Mr. RS who presented with asymptomatic hyperglycemia on 8 March 2018. His height was 185 centimeters, weight 121, BMI 35. Obviously, he is obese, and his BP 134/76 and RBS 264. A1C 9.4. I started him on metformin plus gliptin plus SGLT2. When A1C is more than 8.5 or so, you should be starting on triple drug, not even single. 2nd October, weight has come down to 103 kg. That means he has almost lost 18 kgs of weight. He stopped all the drug. December 19th, A1C 6.4, weight is 102 kg. What do you call this case, right? Then we have another case vignette 2 and 3. Mr. N, 63-year-old, 2013, type 2 diabetes, height 169, weight 73, BMI 26 kg, started on metformin, gliptin, sulfonylurea, A1C 7.2. By 2020, that is 7 years later, his weight has come down 5 kg, BMI 23 from 26. Of all oral antidiabetics, A1C 6.2. Third patient, Mr. MAB, 38 years, and was seen on 2015, 162 centimeters tall, weight 74, A1C 7.4, on metformin SGLT2. By 2018, 3 years later, weight has come down to 61 kg, almost 13 kg, and his A1C 5.9. What do you call these patients in this case? So the flow of my talk will be what is reversal of diabetes or what is remission of diabetes, what is the lifestyle modification, and what about the direct trial in UK, NHS, bariatric surgery? Does remission of diabetes reduce micro as well as microvascular complication as well? Finally, we are going to summarize. So we all had an idea that once you are diabetic, you are lifelong diabetic. Diabetes cannot be cured, but can only be controlled. Once you start medicine, lifelong medication, you cannot stop medication for diabetes, hypertension, cholesterol, as well as hypothyroid. All these myths have been proved to be wrong. We said currently no cure for diabetes exists, but disease can go into remission. This is the final word. As you see, type 2 diabetes is a progressive disease. The fasting will be normal, goes on increasing. Then the postprandial also goes on increasing. From normal glucose tolerance to pre-diabetes to diabetes, as you can see in this chart, as the insulin resistance remains same, but the beta cell failure occurs, and that is why the insulin level from the normal glucose tolerance to pre-diabetes, the insulin resistance increases. From there, from pre-diabetes to diabetes, it is not insulin resistance that is increasing, but the insulin reserve, the beta cell reserve goes down. So also complication, at the beginning no complication, then as the duration of diabetes increases, micro and macrovascular complication also increases. What do you mean by remission of diabetes? Also, there is no cure for diabetes type 2. Studies show it is possible for some people to reverse it, or we call remission. We may not use the word cure, but remission is the word. Through diet changes, weight loss, you may be able to reach and hold normal blood glucose level without medication. That's why I told you 3 cases where they lost weight, they have stopped anti-diabetic drug, and they have gone into it. The diabetes care defines the remission of diabetes into 3 types. A partial remission, when a person has maintained blood glucose level lower than that of a person with diabetes for at least 1 year without needing to use any diabetes medicine. This is partial remission. Complete remission means when the blood glucose level returns to normal levels completely outside the range of diabetes or pre-diabetes and stays there for 1 year without any medication. What do you mean by prolonged remission? When the complete remission lasts for 5 years, then it is called prolonged. That means there are three types of remission, that is partial, complete, and prolonged. Then what is the definition? There are a lot of different definitions. I would like to say this is one of the comprehensive one. Remission of type 2 diabetes was previously defined as being off diabetes medication with normal fasting glucose 70 to 100 or a A1C level less than 6. This definition was used in recent meta-analysis of bariatric surgery. But other than bariatric surgery, it is different. In 2009, consensus statement, partial remission of diabetes was defined as hyperglycemia, that is A1C less than 6.5, or fasting between 100 to 124, at least 1 year after surgery in the absence of active hypoglycemic pharmacological therapy or ongoing procedure. All these definitions are true for bariatric surgery. Whereas what we are talking is reversal or quote unquote cure. This is the definition of AIIDR, which defines remission of type 2 diabetes, not a cure. Remission of type 2 as a return to normal measure of glucose metabolism and A1C below 6, fasting below 100, at least 1 year after bariatric surgery without hypoglycemic condition. Strategies to achieve this include standardizing definition of effect of surgery, avoiding the term cure and remission unless they are defined very carefully. That way, this is the AIIDR definition of remission of diabetes with bariatric surgery without anti-diabetic drug. How do we achieve the reversal of diabetes? A lot of people talk about lifestyle modification. Some people say there's nothing but the naturopathy, exercise and diet, and as told you, bariatric surgery, and even islet cell transplantation, stem cell therapy is also one way of reversal of diabetes. So how can we reverse diabetes? The key seems to be weight loss. Not only can shedding pounds or kgs help you manage your diabetes, sometimes losing enough of weight can help you to live diabetes free, especially if you have only had the disease for a few years and have needed it. So there are some caveats. Everybody cannot be reversed. Some people are claiming you are going to reverse diabetes, you stop insulin, which is all hoax. So we should know from evidence-based medicine who can reverse, who cannot, when and how and where. This is one of the studies known as direct study, that is intensive lifestyle intervention, remission in type 2 diabetes, durability of a primary care-led weight management intervention for remission of type 2. This is 2-year results of a direct open-label custom randomized study, which is done by National Health Scheme UK. 298 individuals between 20 to 65 years with less than 6 years duration, very important. Beyond 5-6 years, it's not possible. Most important, BMI 27 to 45. If you are normal weight, underweight, you cannot. Not repeating insulin. These are the most important thing. Age group and diabetes less than 5 or 6 years duration, BMI 27 to 45 and not taking insulin. These are the type of patients where it is going to help. This was published in Lancet Diabetes in 2019. So research spotlight is putting diabetes into remission. What they did, low calorie weight management program, put diabetes into remission. This direct remission clinical trial, NHS, low calorie diet help people to put their type 2 in remission, and what they use 850 calories per day. Most of us take 1500 to 2000. Very difficult to follow 850 calories per day. Remission or reversal, keeping A1C below 6.5 without needing any medication for diabetes. This is the definition of reversal according to direct study. Let us look at the result. Total diet 825 to 853 calories per day for 3 to 5 months. Then stepped food reintroduction 6 to 8 weeks. Then structured supports of weight loss and maintenance phase from an end of food reintroduction up to 24 months. Participants were offered monthly 30 minutes appointment with the dietitian, practicing nurse using tailored workbooks. So this is how it is, very intense lifestyle modification and monitored diet. Both anti-diabetes and anti-hypertensive drugs were withdrawn for the intervention participants on day 1 of total dietary replacement with protocol reintroduction. What does the result show of direct study? 45.6% of those who took part in the program were in remission at the end of 1 year. 70% were still in remission by the end of year 2. Overall, more than one third, 36% of the people were in remission of their type 2 diabetes 2 years after taking program. So this is what it is. So 45% 1 year and 70% of those 45% even at the end of 2 years. Second year result showed again that remission is closely linked to weight loss. So the co-primary outcome at 24 months, weight loss of at least 15 kg. The UK study showed you should lose 15 kg to get into remission. And remission, as I told you, less than 6.5 without any medicine at 12 and 24 months. Look at the chart. At the end of 1 year and 2 years, control groups, nothing. When you see patient at the end of 1 year and 2 years, and you see here 24.2% of the participating achieving the weight loss, at the end of 2 years, 11.4. Look at the amount of control and intervention in them, 45% at the end of 1 year and 35.6% at the second year. These are the participating achieving the A1C reduction less than 6.5%. So whether it is weight loss or whether it is A1C, I can see first year here 24.2 weight loss, 45%, A1C below 6.5. Second year 11.4 achieved the weight loss, and here A1C less than 6.5, 35%. Meaning one third of the patients in this study achieved the target and they went into remission. Now the question again is people who lost 5 kg, 5 to 10 kg, 10 to 15 kg, more than 15 kg. As is only 3.6% achieved the A1C 6.5. Whereas those who lost 5 to 10%, 10 kg, it was 33 and 28%. Those who lost 10 to 15 kg, they are the ones achieved 57% or 60% achieved A1C below 6.5. But patient who lost more than 15 kg of weight, they are the ones who are able to achieve the first and second year. 86% of them achieved 6.5 or less without medicine, and second year 70%. This is to show in UK studies you have to lose more than 15 kgs to achieve the remission. Low calorie diet, that nearly half the people took part reversed their diabetes, kept their blood glucose near normal for at least 6 months to a year. Type 2 diabetes is a complex condition. This approach will not work for everybody. As I said, normal weight people, underweight people, they can't lose that much, so it will not work. So it can be a life-changing one. So this is how you see that in bariatric surgery, in routine clinical care, 3 out of 4 individuals with type 2 and obesity treated with RY gastric bypass experienced diabetes remission first year. 27% of these individuals has relapsed at the end of 5 years. Now we have got 15 years of data about post-bariatric surgery. RY gastric bypass was associated with substantially decreased risk of microvascular complication, non-significant fear microvascular, meaning that not only bariatric surgery reversed diabetes or remission, but also reduced micro and macrovascular complication. Early diabetes remission was a clear predictor of reduced microvascular complication. Again, just like that in bariatric surgery, you have to lose 10 to 15 kg weight. And if the diabetes onset is less than 5 years, then only you can reverse it. Patient taking lot of insulin dose are not going to. These are the points. Even in bariatric surgery, it should be done within 5 years of onset of recognition of diabetes. This is a long-term results of 608 severely obese patients underwent gastric bypass with a 93% follow-up for 14 years. This is what I told you, we have got almost 15 years follow-up. Of 146 patients with type 2 baseline, 83% are normoglycemia without diabetic medicine. As you can see here, you can see 25 or 30% of the patients had gone into remission. Glucose levels often normalize with just a few days after surgery, even much before weight loss, before any significant weight loss occurs. That means the bariatric surgery effect of reducing blood sugar is not just related to weight loss, it has got so many other effects because of gastric bypass. So reversal of type 2 after bariatric surgery determined by degree achieved weight loss in both short-term and long-term duration. This is what I told you, number of type 2 patients and full and durable remission. As you can see here, available for follow-up, resolution free. That means full, this one was 183 and 83% of them had resolution of diabetes, and from diabetic they become the impaired glucose tolerance in 150. As you can see, 99% here, 83%. Same thing, 495 surgeons reporting more than 110,000 bariatric surgery. Hospital mortality was 0.14, overall mortality 0.29, and if we see that readmission was about 4.75, reoperation occurred into. Some people could not, they started having problem, they had to reoperate, meaning that adverse effect of bariatric surgery was much less. So, Roux-en-Y bypass, 1,111 individuals type 2 treated with this in northern Denmark, 1,074 matched non-operated individual. Diabetes remission was defined as HbA1c less than 6.5 or metformin monotherapy. This is what the remission. What did it show? It showed, if you look at this and how you see the proportion of individuals per time interval as such, as you can see, non-remission here, remission. We see from 0 months to even 60 months, that means 5 years follow, more and more patients had remission of diabetes. What about when you get remission, whether by bariatric surgery or intense lifestyle modification, what happens to micro and macrovascular complication? As we know, diabetes is not just metabolic disease, it's a vascular disease. So changes in the blood vessels are noticed many years even before the diabetes. This study shows placebo versus metformin lifestyle modification. As you see, aggregate of all microvascular complications compared to placebo, metformin and lifestyle modification, microvascular disease decreased with lifestyle modification. Again, you see nephropathy compared to metformin, the lifestyle modification reduced. Again, if you see neuropathy, reduced much more than placebo, than metformin, lifestyle modification. Retinopathy also, showing that the microvascular complications are also less when we have the reversal of remission of diabetes with intense lifestyle modification. This is another beautiful study published in 2019 Diabetologia, comparing Roux-en-Y bypass, and you see micro and macrovascular complication. I can see there is a very distinct decrease in microvascular complication in the persons who have undergone bariatric surgery, meaning that once you undergo bariatric surgery, you lose weight, remission of diabetes can occur even up to 15 years, and microvascular complication are significantly less. Even macrovascular complication also comes down with bariatric surgery. So is diabetes remission important? Yes. Is type 2 diabetic bariatric surgery promotes remission to normal glycemia? Yes. It reduces the diabetes related endpoints as I told you. Is it important? Maybe, because it promotes remission, reduces number of drug use, but may lead to withdrawal of important beneficial effect of the drug. To summarize my talk, there is no cure for diabetes currently, but the disease can go into remission, which may be temporary, which may be 5 years, it may be permanent also. Remission or reversal is keeping A1C below 6.5 without needing any medication for diabetes. Through diet changes, weight loss, as I told you, 10 to 15 kg or more, you may be able to reach and hold normal blood sugar levels without medication. This is possible if you do within 5 or 6 years of onset or recognition of diabetes, provided you lose 10 to 15 kg, provided you are not on insulin. So, lifestyle modification, bariatric surgery can achieve remission. So, the take home point is that in newly detected diabetic, lifestyle modification, 10 to 15 kg of weight loss can reverse diabetes, provided diabetes is onset within 5 years of diagnosis. Initial intensive control of diabetes and reduces glucose toxicity. That's why beta cell will start functioning in this patient. Patient demands are reduction of oral anti-diabetic drug. Achieving A1C even below 7 is good enough. And spontaneous reversal is also possible. You may argue that yes, we have seen many patients without intense lifestyle modification. With a lot of elderly patients can have spontaneous remission of type 2, it is well known. New onset diabetes patient refuses the oral diabetic drug. You can try lifestyle modification, give him 3 months or 6 months of intense lifestyle modification. He may go into the remission. Thank you for your attention. Once again, I thank the organizers and Dr. Mayur Patel and his group for giving me an opportunity for presenting my reversal of type 2 diabetes, my experience, my opinion. If there are any questions, I'll be very happy to answer those questions. Thank you once again.
Thank you so much, Dr. KM, sir.